And welcome to another edition of Your Health with MU Healthcare on KXEO. Today I have Beth Orns, and I believe you're a social worker here with MU Healthcare. Is that right?
Yes, I am a social worker and a manager at the Missouri Psychiatric Center.
Wonderful. Thanks for joining us today. And we're going to kind of talk about a group that's formed to support parents who are struggling with postpartum. If you could kind of give us an explanation about that group today.
Sure. So postpartum depression and anxiety are the most common complication of pregnancy. And so myself and a couple of other social workers and a psychiatrist got together and decided that we wanted to do something to help support parents who are struggling. So we started this group about a year ago. It's a support group for parents who are struggling with postpartum depression or postpartum anxiety. It's an open group. We meet on the third Tuesday of every month at 6 o'clock at the South Providence conference room. It's from 6 to 7:30, and we invite any parent who feels like they could benefit from that group to join us.
What are some of the signs that you might be suffering from postpartum depression and or anxiety, if you would?
Sure. So struggling with feeling down or low, difficulty with sleeping. It may be that you're not able to sleep, or it might be that you're sleeping all the time. It may be just struggling to feel like you have the energy to do any of the things that you need to do, feeling overwhelmed. I think the feeling overwhelmed is common both with postpartum depression and postpartum anxiety. Also, intense irritability is something that we hear a lot with parents who are struggling with postpartum mental health issues. And with the anxiety is a lot of fear that you're going to do something really awful to your baby, which is a barrier for a lot of people in getting help. They're afraid that if they speak out that they are going to be seen as not being a good enough parent, and so they tend to keep it all inside instead of seeking the help they should.
What are some of the benefits to joining this group? Is it the group atmosphere where you hear other people are going through this?
I think that's been one of the biggest benefits for the members of the group, has been just feeling like they're not alone. Being able to openly talk about their feelings and feel validated versus judged. I think that's powerful for any parent, regardless of where you're at in your journey as a parent. I think just taking off that mask that we put out there in the world and just being honest about what we're struggling with is just really a powerful thing. And just being able to access help. Being able to access every group that we have, we offer an educational component to it. So we talk about some issue that relates to postpartum mental health that the group members have identified in previous weeks that they'd like to talk about. And so that educational piece is really helpful. It gives people some tools, some training to help them be able to better deal with things. And having Dr. Brandt as a participant in the group, as a group leader, has been phenomenal. She's an expert in postpartum mental health and perinatal mental health, and she is just a rock star. She has a clinic where she sees patients with those issues for psychiatry, and so she is able in real time at that group, when members have questions about their meds, after group answer them. She's not there to be their doctor, but she can help allay some of those fears or questions that people were afraid to ask their doctor maybe. She can kind of help them with those things, and so that's been really helpful for a lot of our group members as well, to have that expert that's really hard to get access to in general in our society, just to have that person sitting there and just being there to help them.
I've heard that men can suffer from
Absolutely.
postpartum depression as well. And that's true?
Absolutely. Any caregiver can experience postpartum depression or postpartum anxiety. Part of what actually got me researching this was a couple of friends of mine who had spouses who struggled with some postpartum anxiety, and I didn't realize that was a thing. And the more I learned about it, the more I realized it is a thing. And it's for real. And, adoptive parents, grandparents who are caregivers, fathers, all can experience the same postpartum depression and anxiety as a mom, but they tend not to come out about it as much. There's a lot of guilt that they experience. This should be all about the mom. This shouldn't be about me. And so they tend not to say as much as they should.
So for guys who are suffering from this, do they go into a group with other women, or are they with men, or is it kind of a mixture?
So the group is open to any parent or caregiver. We've even had members come and bring a friend with them that may not be struggling but wants to be. They feel like they need support, and that's completely welcome as well. We've had a dad at group before, and that's welcomed. Anybody who needs a group is welcome to come to it. We don't have a specific dad's group and a mom's group because really so many of the issues are the same either way. is how do we deal with our mood, how do we deal with our feelings, and how do we manage this new life that we're responsible for taking care of while managing our own needs.
No doubt. If you think you're suffering from this, what are some of the first steps that you would go to get into this group?
So the group is open to anybody. You don't have to pre-register. There's no costs. We don't document in the medical record that you came to group, which is really helpful for some people. They want that anonymity, that they aren't, it's not something that's going to anybody in particular. We do keep, just a general data sheet for everybody just so that we know if there's an emergency who to call. But anybody is welcome to come. If they have questions, they're welcome to reach out to me or any of the other group leaders, whether it be what do I do about childcare, any of those kinds of things. We're happy to answer those questions or help try to connect to a resource that can help them. If groups several weeks out and you're struggling, I encourage people to reach out to their primary care provider, to their obstetrician, to anybody that they trust, and talk about it. Talk to someone, seek help. If they think they may need meds, that can take a little while to get the full effect. So the sooner you can get going with that, the better off you are. So really just reaching out, like I said, to primary care providers and obstetricians. So they're usually the best first places to start when it comes to postpartum depression, if you feel like that might be something you need medication-wise. And like I said, our group is every month, and it's welcome and open. And there's tons of counselors in town, too, who are always available and have openings and are able to help people as well.
Is there any kind of a timetable that you put on these classes, or 2 months you're okay, or can you continue to come to those?
We've had people who have come just once. We've had other people who have come many months in a row. We do kind of encourage it to be people who are within their first year postpartum, just because that's the diagnostic criteria for both of these disorders. But we've had people who have children older than a year old who have come, and we're not going to send somebody away who needs to be there. If anybody thinks that this might be helpful for them and they have questions, please feel free to reach out, and I'm happy to help them figure out if we're the right fit, and if not, who might be.
Nice. How would people go about getting hold of you here at MU Healthcare?
Sure. They can email me. That's probably the easiest way to reach out. And my email is ornse@health.missouri.edu.
Nice. Well, I certainly appreciate you taking your time and talking to us. Have I missed anything, or have we pretty well covered everything?
I think it's really important that people know that this is important to deal with, and it's not something you do just for yourself, but it's something you're doing for your child. Parents who have postpartum mental health issues, who deal with their own issues, their children have better outcomes, mental health wise and attachment wise. And so if you're not going to get help for yourself, get it for your child.
Great advice. Thank you for taking your time out today, Miss Beth Orns, the social worker at Missouri Psychiatric Center. It's been another segment of Your Health with MU Health on KXEO.